Hello my lovely ladies, I'm Dr. Susan Hartley and welcome back to Life After 70 Women's Edition. Today, we're talking about something many women whisper about, or don't talk about at all. And that's bleeding after menopause. If you're in your 70s or beyond and have noticed spotting, discharge, or even a return of a period, you might be asking, is this normal or is my body trying to tell me something? Ladies, let's begin by talking about something that may feel confusing or even a little frightening, and that's bleeding after menopause. Now, you may have stopped having your period 15, 20 or even 30 years ago. So when you see spotting on your underwear or notice a small amount of blood when you wipe, it's natural to feel worried. You might think, this can't be normal at my age. And truthfully, in most cases, you're right to pay attention. But please don't jump straight to fear. Postmenopausal bleeding is not considered a normal part of aging, but that doesn't automatically mean it's something dangerous. What it does mean is that your body is trying to tell you something, and together, we can gently figure out what that is. You see, menopause marks the time when your ovaries stop releasing eggs and your body stops having periods. This typically happens between ages 45 and 55. Once you've gone a full year without a period, you're considered to be in menopause. And after that, your uterine lining should no longer build up and shed the way it used to. So, if bleeding happens after this phase, whether it's light spotting or something more like a flow, it's always worth looking into. Think of it like your body sending you a little message. Something has changed, and I want you to notice. It might be a whisper, not a scream. It might not be serious at all, but it deserves your attention. Some women feel embarrassed to even bring this up. They might think, I'm too old to deal with periods again, or maybe it's just part of getting older. But let me tell you, there is no age limit on taking care of yourself. Just because something is common doesn't mean it's normal. And just because it's happening down there doesn't mean it has to be whispered about in shame. You have every right to ask questions, to feel comfortable in your body, and to demand answers when something doesn't seem right. I want to reassure you that in many cases, the cause of postmenopausal bleeding is not cancer, and it's not something life-threatening. In fact, some of the most common causes are completely treatable, often without surgery or complex medications. One of the biggest culprits is vaginal dryness, something I talk about often with my patients. After menopause, estrogen levels drop, and with them, the natural moisture and elasticity of the vaginal tissues decrease. You might notice things feel thinner, more delicate, or even papery down there. When the tissues lose that soft, plump texture, even simple things like wiping after the bathroom, sitting on a hard chair, or intimacy can cause tiny tears or spotting. Another extremely common issue is something called atrophic vaginitis, which is just a fancy term for inflammation of the vaginal walls due to dryness and thinning. It may sound scary, but it's actually quite treatable. You may feel itching, burning, or a sense of pressure. Some women notice a watery or slightly blood-tinged discharge. Others don't feel much of anything until they notice the spotting. It's frustrating, I know. But once identified, it can often be managed with estrogen creams, moisturizers, or even lifestyle adjustments. And the relief can be life-changing. Polyps are another reason some women experience light bleeding. These are small, usually non-cancerous growths in the uterus or cervix. Think of them like little skin tags, but inside. Sometimes they grow quietly and only show themselves through light bleeding or discharge. The good news is they can often be removed in a quick and gentle outpatient procedure. And once they're gone, the bleeding typically stops. Again, this is nothing to be ashamed of, and you haven't done anything wrong to cause it. I've even had patients who were bleeding a little simply because they had a urinary tract infection or had been straining with constipation. Things that put pressure on the delicate pelvic area and can lead to some minor bleeding. Our bodies are deeply interconnected, and sometimes small disruptions can show up in surprising ways. Let's say you've experienced some bleeding, maybe just a few drops on the tissue, or maybe a light spotting in your underwear that surprised you. What should you do next? This is where many women freeze. They second-guess themselves. They think, well, it only happened once, or it's probably nothing. I don't want to bother the doctor. I've heard these exact words from women for decades. And I want to gently challenge that thinking. Even if it happens just one time, any postmenopausal bleeding deserves to be checked out. You are not overreacting, and you are never too old to care about your health. The truth is, a single conversation with your doctor can give you peace of mind, or catch something early that may need attention. Either way, you win by listening to your body. I always tell my patients if your eyes were suddenly red and irritated, or if your knees suddenly gave out, you'd probably get it checked. Vaginal bleeding after menopause should be treated with the same attention. It's not about panic. It's about being wise. You know your body better than anyone else. If something feels off, even slightly, trust that little voice inside. You've lived long enough to know when something isn't quite right, and while it may feel uncomfortable to talk about, your doctor, especially if they specialize in women's health, is there to help, not judge. It's helpful to write down a few details before your appointment. Note the day the bleeding occurred, how much there was, what color it was, and whether you felt any pain or discomfort. Did it happen after intimacy? Was it just once, or has it happened more than once? This helps your doctor understand what might be going on. And remember, you don't have to explain everything perfectly. Just speak from the heart. A good doctor will listen, ask gentle questions, and guide you through the next steps. Now let's talk about something that might be in the back of your mind. The what if that none of us like to say out loud. Could the bleeding be something more serious? The honest answer is yes, sometimes it can be. And I say that not to scare you, but to empower you. Because here's the beautiful truth: when caught early, most of these conditions are very treatable, even curable. The biggest danger is not the bleeding itself. The biggest danger is ignoring it. One possible cause of postmenopausal bleeding is cancer of the uterus, also known as endometrial cancer. It's actually the most common gynecologic cancer in women, and in most cases, the very first symptom is unexpected bleeding. But here's the good news: when it's found early, the success rate of treatment is extremely high. I've seen many women go through treatment and come out on the other side stronger, healthier, and so relieved that they didn't wait. And many of them had only a tiny bit of bleeding. Not pain, not exhaustion, just a small change that they paid attention to. Another cause could be cervical changes, such as precancerous cells or early-stage cervical cancer. These conditions also tend to develop slowly, and if caught early, they're very manageable. Many times, what seems like a scary word, cancer, actually turns out to be a very small area that can be removed or treated with minimal intervention. That's why having the courage to get checked is such a gift to yourself. It gives you clarity, and it gives your doctor the chance to help you early, when everything is still small and manageable. There are other less common but possible causes too, such as thickening of the endometrial linings called hyperplasia, which can also cause bleeding. This condition doesn't always turn into cancer, but it's something that doctors like to monitor. If needed, there are simple treatments that can thin the lining and reduce or stop the bleeding. Again, the key is not to panic, but to get the right information so you can take the next step from a place of calm and confidence. I know this kind of talk can stir up old fears. Maybe you've had friends or sisters who've gone through difficult diagnoses. Maybe you're thinking, I don't want to know if it's something bad. And I understand that. But I want to offer you a new perspective. Not knowing doesn't protect you, it only prolongs the anxiety. Knowing, even when the answer is hard, gives you power. It gives you time. It gives you options. And if the answer turns out to be simple, you'll wonder why you waited so long to ask. My dear friends, you've faced much harder things in your life than a doctor's visit. You've raised families, survived loss, managed illnesses, made tough decisions, and kept going through every season. This moment is just another one of those. A time to listen to your body, ask a question, and take a gentle step forward. You don't have to do it alone, and you don't have to do it perfectly. You just have to begin. The first step is usually a simple conversation. Your doctor will ask questions about your symptoms, how often the bleeding happens, how heavy it is, whether you feel any pain or pressure, and whether anything seems to trigger it, such as intimacy or physical activity. Try to be as open as you can. Your comfort matters, and a caring doctor will always move at your pace. If something feels confusing or overwhelming, just ask them to explain it again in simpler terms. You are not expected to know medical language, that's our job. Next, a basic pelvic exam is often recommended. Now, I know these exams aren't anyone's favorite. After 70, your body has changed, and the experience might feel different than it did when you were younger. but a skilled and respectful provider will make sure you're as comfortable as possible. The exam helps your doctor see if there's any thinning, inflammation, or visible bleeding around the vaginal walls or cervix. Sometimes just seeing the area can provide valuable clues. If needed, your doctor may recommend an ultrasound, typically a transvaginal one. This might sound scary, but it's actually a very gentle test. It involves placing a thin, smooth probe just inside the vagina to get a better look at your uterus and the lining inside it. Think of it like a little flashlight that helps us see what the eyes can't. It's usually painless or just slightly uncomfortable, and it only takes a few minutes. The goal is to see whether the lining of your uterus is thickened or if there are any polyps or growths that might be causing the bleeding. Another tool we sometimes use is called an endometrial biopsy. This is a very quick procedure where a tiny sample of tissue is taken from the lining of your uterus. It can be done right in the office and usually takes less than a minute. I always tell my patients this is a moment of small discomfort that can give us big answers. If the idea of it makes you nervous, you're not alone. Just let your provider know your concerns. There are ways to make it easier, whether that's going slowly, using numbing medication, or even breaking the steps down to help you feel more at ease. In some cases, if more clarity is needed, your doctor might suggest a procedure called a hysteroscopy, where a tiny camera is used to look inside the uterus. But that's not something we jump to right away. Most of the time, the combination of an exam, ultrasound, and possibly a biopsy gives us the information we need. Now here's the part I really want to emphasize. None of these tests are about fear. They are about clarity. They are about giving you a sense of control. They are about finding answers so you're not left wondering, guessing, or worrying in silence. Every step you take toward understanding your body is an act of self-respect. It's not selfish. It's not dramatic. It's wise. And it's powerful. One of the most heartbreaking things I've heard from women is, "I didn't think I mattered anymore." After 70, it's easy to feel invisible, like the world has stopped looking at you, listening to you, or taking your needs seriously. But let me say this clearly, you matter now more than ever. You are not invisible. You are not forgotten. And your body, even with all its changes and challenges, is still worthy of gentle care, attention, and love. You've carried so much through the years, maybe children, maybe partners, maybe grief, maybe joy. Your body has housed all of that. It has served you through decades of living, working, loving, and surviving. So when something changes, like unexpected bleeding, it's not a failure, it's a signal. And you deserve to hear that signal without fear, and with support. You also deserve dignity. That means having doctors who explain things to you in a way you understand. It means being treated like a whole person, not just a number or a checklist. It means being listened to when you speak up about pain, discomfort, or worry. And if you ever feel dismissed or rushed, please know this: you are allowed to find a provider who listens better. It's never too late to advocate for yourself. You are never too old to be heard. This chapter of life can be deeply empowering if we let it. I've had patients who say, "I've finally reached the age where I don't care what anyone thinks. I speak my mind, I take care of myself, and I make decisions that are good for me." That's the spirit I want you to carry into every doctor's visit, every health decision, and every moment when you feel unsure. You've earned the right to be confident in your body and your voice. If you've experienced postmenopausal bleeding, let this be your reminder: you are not alone. You are not broken, and you are not the only one going through this. Many women in their 70s, 80s, and even 90s experience this and come through it with clarity. Treatment. What makes the difference is not ignoring it. So talk to your doctor, ask the questions, request the tests if needed. And always expect to be treated with the care and kindness you deserve. Because you are not just a patient, you are a whole person with a lifetime of strength, wisdom, and worth. Let your healthcare reflect that. You're not just surviving this stage of life. You're still living it. Still learning, still growing, still deserving of joy and comfort and confidence in your health. I'm proud of you for even being curious about this topic. Keep going, keep asking, and know that I'm right here, cheering you on every step of the way.